Welcome back, everyone. Today's deep dive is all about something that affects millions, maybe even you, reflux esophagitis. You probably know it better as GERD, but it's more like GERD's more intense cousin, right?
Yeah,
Yeah.
you could say that. It's like the difference between a little spill and a full-blown kitchen fire. A little reflux every now and then, that's normal. But when it's constantly happening, it can actually damage the lining of your esophagus.
Okay, so this is serious business then, not just a bit of discomfort. What causes it? What's going on in our bodies?
Well, think of it like a pipeline. At the bottom, there's a valve called the lower esophageal sphincter, or LES. It's like a door keeping stomach acid down where it belongs. But sometimes that door malfunctions, gets a bit leaky.
Leaky. So stomach acid is escaping back up, and that's what's causing the burning.
Exactly. And there are a few things that can cause this. Sometimes it's structural, like a hiatal hernia where part of the stomach pushes up through the diaphragm. This puts pressure on the LES, making it harder to close properly.
Wow, so the stomach's literally out of place. I can see how that would be a problem. But you said there are other causes too, right?
Yeah, sometimes it's not structural, but functional. The LES itself could be weakened, or it's not closing tightly enough for different reasons, like certain medications, smoking, or even eating too much at once.
This is making me rethink my late-night snacking habits.
Well, that brings up another point. Some foods and drinks can relax the LES, making reflux more likely. Spicy foods, citrus fruits, chocolate, caffeine, even fatty foods. Although they're delicious, they delay stomach emptying, which puts more pressure on the LES.
So it's not just what we eat, but how much and when.
You got it. It's all about understanding how our lifestyle choices affect our digestion. Now, you might be wondering how this all leads to reflux esophagitis, the actual inflammation.
I am, actually. How do we get from a leaky valve to full-blown inflammation?
Imagine spilling a little coffee on your desk. You wipe it up, no problem. But if you leave it there for hours, it'll damage the surface. That's what happens with reflux esophagitis. The stomach acid, which is very acidic, keeps touching the lining of the esophagus, causing irritation and inflammation.
Okay, so it's not just the acid reflux, it's the length of time it's sitting there causing damage.
Exactly. To break this down further, our sources outline 4 key mechanisms at play here.
4. Okay, I'm all ears.
The first, as we've discussed, is LES dysfunction. That leaky valve lets the acid escape in the first place. But then there's how much acid your stomach's producing. Some people naturally produce more than others, making reflux more likely. That's gastric acid hypersecretion.
Right, so more acid, more potential for damage. What's number 3?
It's called impaired esophageal clearance. It's the esophagus' ability to clean up the mess, so to speak.
Clean up the mess. How does it do that?
It has a couple of tricks. One, it has these wave-like muscle contractions called peristalsis that push food down but also clear away acid. And then there's saliva, which is naturally alkaline and helps neutralize the acid.
So if those cleaning mechanisms aren't working properly, the acid just hangs out longer, causing more irritation.
Exactly. And finally, there's delayed gastric emptying.
Meaning the stomach's not emptying as efficiently.
Right. If food sits in the stomach longer than it should, it increases pressure, making reflux more likely.
So it's often a combination of these factors that leads to reflux esophagitis, not just one thing.
Absolutely. It's rarely just one isolated issue. And this is where things get tricky because everyone experiences it a little differently.
Speaking of experiencing it, let's talk symptoms. We know about the heartburn, but what are some other signs that this might be something more serious?
Well, heartburn is the most common, but there are a few other red flags. For example, have you ever experienced regurgitation where food or liquid comes back up into your mouth?
Can't say that I have, thankfully, but I can see how that would be a sign something's off.
Definitely. And then there's difficulty swallowing or dysphagia. It feels like food's getting stuck in your throat or chest.
Oh, I've experienced that before. I just assumed I was eating too fast or something.
Well, that's possible, but if it happens frequently, it's worth checking out. And then there's odynophagia.
Okay, that one sounds more serious. What is it?
Odynophagia is when swallowing is actually painful. That's a sign that the lining of the esophagus is really irritated and inflamed.
Ouch. That sounds like a sign to see the doctor for sure.
Absolutely. And here's one that might surprise you. Chest pain.
Chest pain. But isn't that a sign of heart attack?
It can be, which is why it's important to get any chest pain checked out by a doctor. But the pain from reflux esophagitis can sometimes mimic heart attack pain.
So how can you tell the difference?
That's where a doctor's expertise is essential. They'll look at your symptoms, medical history, and other factors. Often they'll need to run some tests to get a clearer picture.
Okay, so if you have any of these symptoms, definitely don't ignore them. It could be a sign of something more serious. But how do doctors actually diagnose reflux esophagitis? What tests are we talking about?
Well, a physical exam can give them some clues, but it's not always enough for a definite diagnosis. Sometimes during the physical exam, they'll look for signs of anemia.
Anemia, why would that be relevant?
Anemia can sometimes be a sign of internal bleeding,
Yeah.
and if someone has chronic reflux esophagitis, they could have some bleeding from damage in the esophagus.
So it's a clue that the condition has been going on for a while and may be causing some damage.
Exactly. But the gold standard for diagnosing reflux esophagitis is an upper endoscopy.
An upper endoscopy, what does that involve?
It's a procedure where a thin, flexible tube with a tiny camera on the end is gently inserted down your esophagus. This lets the doctor see the lining of your esophagus and stomach, looking for abnormalities.
So they can actually see if there's inflammation or damage from the acid.
Yes, and they can take biopsies during the procedure, little samples of tissue they examine under a microscope. This helps confirm the diagnosis and rule out any other conditions.
Makes sense. Are there any other tests?
There are a few. One is called 24-hour pH monitoring.
24-hour pH monitoring, what's that?
Basically, a thin tube with a sensor is put in your esophagus, and it measures the pH level, how acidic it is, over a 24-hour period.
So they can see how often and how bad the acid reflux is.
Exactly. It helps link your symptoms to actual reflux events. Then there's esophageal manometry.
Manometry, what does that one measure?
This one measures pressure and muscle contractions in your esophagus. It looks at how well your esophagus squeezes to move food down, and if those contractions are strong enough to clear away refluxed acid.
So like checking the strength and coordination of your esophageal muscles.
Good way to put it. And finally, there's the barium swallow test.
Barium swallow, that sounds interesting.
It's actually pretty straightforward. You drink a liquid with barium in it, which shows up on x-rays, and then you swallow while the x-ray machine takes pictures. This lets the doctor see the shape of your esophagus and spot any structural problems that might be contributing to the reflux.
So like a real-time video of your esophagus in action.
Precisely. All of these tests, along with your symptoms and medical history, help the doctor diagnose and create a treatment plan.
And that brings us to treatment. What are the options?
Well, the good news is there are several, and they often start with things you can control.
Okay, I like the sound of that. Tell me more.
Lifestyle changes are often the first line of defense, and they can be very effective.
I'm listening. What kind of changes are we talking about?
Well, as we talked about, some foods and drinks can trigger reflux. Paying attention to your diet and figuring out what your personal trigger foods are is key.
So it's like a detective game, figuring out what your body doesn't like.
Exactly. And beyond, diet weight loss can make a big difference. Extra weight, especially around your belly, increases pressure on your stomach, which can push acid up.
So even losing a little weight could help.
Absolutely. Another simple change is elevating the head of your bed.
Wait, what? How does that help?
By raising your head 6 to 8 inches, you're using gravity to your advantage. It makes it harder for acid to flow back up while you're sleeping.
That's such a simple but clever solution. I'm gonna have to try that. Any other lifestyle tips?
One more, avoid big meals, especially close to bedtime. Give your body time to digest before lying down.
That makes sense. So these lifestyle changes are often the first step, but what if they aren't enough to control the symptoms?
Then medications might be recommended. There are a few types that can reduce acid production, neutralize existing acid, or improve how your stomach and esophagus work.
Okay, let's talk meds. What are the different types?
One of the most common and effective is proton pump inhibitors, or PPIs.
PPIs, I've heard of those. What do they do?
PPIs block the production of stomach acid right at the source. They basically shut down those pumps in your stomach that make acid.
So less acid, less potential for damage.
Exactly. And they're usually very effective at controlling symptoms and letting the esophagus heal.
Any familiar names in that PPI category?
Yeah, you might recognize names like omeprazole, esomeprazole, lansoprazole, and pantoprazole. Those are all commonly prescribed PPIs.
Okay, good to know. What other options are there?
Another class of medications is H2 blockers.
H2 blockers, how do those work?
They reduce acid production too, but a little differently than PPIs. They block a specific receptor in the stomach that's involved in making acid.
So they're basically targeting a different part of the acid production process.
Exactly. They're not as strong as PPIs, but they can be good for people with milder symptoms.
Are there any common H2 blockers you can name?
Sure. Two common ones are ranitidine and famotidine.
Got it. So we've got PPIs and H2 blockers, both working to reduce acid. What else?
Well, there are also antacids, which you're probably familiar with.
Antacids, like Tums and stuff.
Yeah, like Tums Rolaids, Melox, things like that. They work by neutralizing the acid that's already in your stomach, so they give quick relief from heartburn.
So they're good for on-the-spot relief, but don't actually fix the root of the problem.
Right. They're a temporary fix, not a long-term solution.
Makes sense. What about that last category you mentioned?
Yes, prokinetics.
Prokinetics, what do those do?
Prokinetics help speed up how quickly your stomach empties, and they also strengthen the contractions of your LES, making reflux less likely.
So they're all about keeping things moving in the right direction.
Precisely. But they can have some side effects, so they're not always the first choice.
Okay, so we've got a whole arsenal of medications to manage this. But what happens if none of it works? Is that when surgery becomes an option?
Yes, surgery is usually reserved for severe cases when other treatments haven't worked or when complications have developed.
All right, let's talk surgery then. What kind of procedures are we talking about?
One of the most common is called Nissen fundoplication.
Nissen fundoplication. That's a mouthful. What does it involve?
It involves taking the upper part of the stomach and wrapping it around the LES to make it stronger and tighter.
So they're basically reinforcing that leaky valve.
Exactly, like giving it a little extra support to do its job.
That makes sense. Any other surgical options?
There's a newer procedure called magnetic sphincter augmentation.
Magnetic sphincter augmentation. Okay, now that sounds intriguing. Tell me more.
This one involves implanting a ring of tiny magnetic beads around the LES.
Magnetic beads, what do they do?
The beads are strong enough to keep the LES closed and prevent reflux, but they separate when you swallow, so food and liquid can pass through.
So it's like a high-tech adjustable valve.
That's a great way to think about it.
Wow, medical technology is pretty amazing these days.
It really is. And it's important to remember that while surgery can be a very effective treatment for some, it's not a decision to take lightly. It's important to weigh the risks and benefits carefully with your doctor.
Absolutely. Well, we've covered a lot here, from lifestyle changes to medications to surgical options. But now for the big question. What happens if you just ignore reflux esophagitis? What are the risks of leaving it untreated?
That's where things can get serious. Untreated reflux esophagitis can cause complications, some of which can really impact your quality of life.
Okay, this is the part I was waiting for. Tell me about these complications. What should we be concerned about?
One of the most common is something called esophageal strictures.
Strictures. What are those?
A stricture is basically a narrowing of the esophagus because of scar tissue.
Scar tissue from the acid reflux.
Exactly. Over time, that chronic inflammation can cause the esophagus to scar, and that scar tissue can eventually make the passageway narrower, making it harder to swallow.
So the esophagus literally shrinks, making it tough to get food down.
That's right. And this can lead to dysphagia, that difficulty swallowing we talked about earlier.
Yikes. That doesn't sound fun at all. Are there any other complications to be aware of?
Yes, another serious one is Barrett's esophagus.
Barrett's esophagus. We touched on this earlier, but can you explain it again?
Sure. Barrett's esophagus is when the cells lining the esophagus start to change and look more like the cells that line the intestine. It's a precancerous condition.
Precancerous, meaning it could turn into cancer.
Yes. People with Barrett's esophagus are at increased risk of developing esophageal cancer, specifically adenocarcinoma.
Wow, so this seemingly simple reflux problem can have some serious consequences if you don't treat it.
That's why it's so important to know the symptoms and get checked out by a doctor if you're experiencing any of them.
Okay, noted. What about ulcers? Aren't those a potential complication too?
Yes, ulcers are another concern. Chronic exposure to stomach acid can cause ulcers to develop in the esophagus.
Ulcers. Those are open sores, right?
Right. And these ulcers can bleed, cause pain, and in some cases they can even perforate.
Perforate? You mean create a hole?
Yes. A perforation is a hole in the wall of the esophagus, which can be life-threatening if it's not treated immediately.
Okay. I'm officially convinced ignoring reflux esophagitis is not an option.
That's the right takeaway. Early intervention is key to preventing these serious complications and maintaining your long-term health. Welcome back for part 2 of our deep dive into reflux esophagitis. Last time, we covered a lot of ground from the causes to the symptoms.
We talked about those 4 key mechanisms, too. Before this, I really didn't understand how complex the whole process is. It's like one thing leads to another.
It really is. Understanding those mechanisms can help you make smarter choices about your own digestive health. Like knowing that fatty foods delay stomach emptying might make you think twice about that late-night pizza.
So true. It's all about connecting the dots between lifestyle choices and digestive health. And speaking of lifestyle choices, we talked about how important they are for managing reflux esophagitis.
Absolutely. Those simple changes like weight loss, avoiding trigger foods, and elevating your head at night can really make a difference.
Right. I'm planning on trying that bed raising trick tonight. But I was surprised to learn that even certain medications can contribute to reflux. It's not always just food and lifestyle.
You're right. Some medications like certain painkillers, blood pressure meds, even some anxiety meds can relax the LES, making reflux more likely. It's always a good idea to talk to your doctor about the potential side effects of any medications you're taking, especially if you're having reflux symptoms.
Right. Knowledge is power. Just knowing about those potential side effects can help you make better decisions about your health. But let's move on to diagnosis. We touched on this in part one, but I want to go a little deeper into how doctors actually figure out if someone has reflux esophagitis. What do they look for?
As we mentioned, a physical exam alone isn't usually enough to make a diagnosis. They'll ask you about your symptoms, medical history, your lifestyle habits, but they often need some tests for a clearer picture.
Right. And we talked about how anemia can be a clue, but not a definite diagnosis. So what are some of the tests doctors use to diagnose reflux esophagitis?
One of the most common is an upper endoscopy, also known as an EGD.
We talked about that last time. Can you remind me what that is?
Sure. It's a procedure where a thin, flexible tube with a camera on the end is inserted through your mouth and down into your esophagus and stomach. This allows the doctor to directly see the lining of these organs, looking for inflammation, ulcers, or other abnormalities.
So it's like a live video feed of your insides.
Exactly. And during the procedure, the doctor can also take biopsies, small tissue samples, to examine under a microscope. This helps confirm the diagnosis and rule out other conditions.
That makes sense. Any other tests they might use?
Another common one is 24-hour pH monitoring. This test measures the pH level in your esophagus over a 24-hour period. It helps doctors see how often and how severely acid is refluxing.
So they can see if those reflux events are happening at the same time as your symptoms, like heartburn or chest pain.
Exactly. It's all about making those connections. And then there's esophageal manometry.
Esophageal manometry, what does that one tell us?
This test measures the pressure and muscle contractions in your esophagus. It helps determine how well your esophagus is working to move food down, and if those contractions are strong enough to clear away any acid that's refluxed.
So it's basically checking how well your esophagus is functioning, moving food down and clearing out acid.
Exactly. And lastly, there's the barium swallow test.
The barium swallow, remind me how that one works.
Sure. It's a simple test where you drink a liquid with barium in it, which shows up on x-rays. As you swallow, the x-ray machine takes pictures of your esophagus so the doctor can see its shape and look for any structural issues that might be causing the reflux.
So it's like taking a real-time video of your esophagus in action.
Exactly. All these tests, along with your symptoms and medical history, help the doctor figure out the right diagnosis and recommend the best treatment plan.
Okay, so let's talk about treatment. Last time we covered everything from lifestyle changes to medications. I want to dive a bit deeper into those medications. Can you remind us about the different types and how they work to actually help with reflux?
Absolutely. If lifestyle changes aren't enough to control your symptoms, medications are often the next step. One of the most commonly prescribed are proton pump inhibitors, or PPIs.
PPIs, those are the ones that block acid production, right?
Exactly. PPIs work by basically turning off those pumps in the stomach that make acid. This reduces the amount of acid in your stomach and makes it less likely to reflux into the esophagus.
So they're tackling the problem at the source.
You got it. They're generally very effective at managing symptoms and helping the esophagus heal.
Are there any common PPIs that come to mind?
Sure, you might recognize names like omeprazole, lansoprazole, esomeprazole, and pantoprazole. They're all widely prescribed.
Good to know. What about the other types of medications?
Another class is H2 blockers. These meds also reduce acid production, but they work differently than PPIs. They block a specific receptor in the stomach that's involved in making acid.
So they're targeting a different part of the acid production process.
Exactly. They're not as potent as PPIs, but can be helpful for milder symptoms.
What are some examples of H2 blockers?
Two common ones are ranitidine and famotidine.
Okay, got it. So PPIs and H2 blockers both aim to reduce acid. And then there are those chewable tablets, right? Antacids.
Right. Antacids work by neutralizing the acid that's already in your stomach. They provide fast relief from heartburn, but they don't actually prevent the reflux from happening.
So they're more like a temporary solution, not a long-term fix?
Exactly. They're good for occasional heartburn,
Well,
but not a solution for chronic reflux esophagitis.
that makes sense. What about that last category we discussed, prokinetics? Those are the ones that help with stomach emptying and LES strength, right?
Yes, prokinetics don't directly target acid production. Instead, they help your stomach empty faster and strengthen the contractions of your LES, making reflux less likely.
So they're all about keeping things moving along smoothly.
Precisely. However, they can come with some side effects, so they're not always the first choice.
Got it. So there are a lot of different medications, each with their own way of tackling reflux esophagitis. It sounds like finding the right one or combination that works best for each person is important.
That's right. It's not one size fits all. You really need to work with your doctor to find the treatment plan that effectively manages your symptoms and improves your quality of life.
Absolutely. Well, we've covered a lot on medications, but let's go back to something we talked about earlier. The complications from untreated reflux esophagitis. This is a really important point because it highlights why early intervention is so important.
I totally agree. Ignoring reflux esophagitis isn't just about dealing with discomfort. It's about protecting your long-term health.
Right, so let's take a closer look at these complications. Can you remind us of the common ones and what they involve?
One of the most common is esophageal strictures.
Strictures, those are the narrowings in the esophagus, right?
That's it. Over time, the chronic inflammation from the acid reflux can lead to scarring in the esophagus. That scar tissue can make the passageway narrower, which makes it harder to swallow.
So the esophagus actually shrinks, making it hard to get food down.
Right. And this can cause dysphagia, that difficulty swallowing we discussed before. Yikes. That doesn't sound good at all. What about Barrett's esophagus? That's the precancerous condition, right?
Yes. Barrett's esophagus happens when the cells lining the esophagus change and start to resemble the cells in the intestine. This change increases the risk of developing a type of esophageal cancer called adenocarcinoma.
So it's a serious complication that shouldn't be ignored.
Definitely not. And then there are ulcers.
Ulcers, those are open sores.
Yes, they are. Constant exposure to stomach acid can lead to ulcers forming in the esophagus.
And those ulcers can bleed and be painful, right?
Right, and sometimes they can even perforate.
Perforate, as in develop a hole.
Exactly. A perforation is a hole in the wall of the esophagus. It can allow food and liquid to leak into your chest cavity, and it's a very serious complication that needs immediate medical attention.
Wow, this has all sounded pretty serious.
It is serious, but it's important to remember that these complications are often preventable with early diagnosis and the right treatment. That's good to hear. So if you're having any of the symptoms we've discussed, like heartburn, regurgitation, or trouble swallowing, it's really important to talk to your doctor and get checked out.
Couldn't agree more. Early intervention is key. Luckily, there are a lot of effective treatment options available, as we've discussed.
Exactly. There's everything from lifestyle changes to medication to surgery for severe cases. It's about finding what works best for you and taking charge of your digestive health.
That's a great point. It's about understanding your condition and having the tools to manage it properly.
Exactly. That's what makes these deep dives so valuable. They give you the knowledge to take an active role in your own health.
I agree. And it shows that you're not powerless against these conditions. You can make choices that positively impact your health.
Well said. Before we finish up part 2, I'm curious, what's been resonating with you most during this deep dive? What's one thing that's really stuck with you?
You know what's really stood out to me is how much our daily choices affect our digestive health. We often think of digestion as automatic, something we can't control. But in reality, our habits have a huge impact on how well our system works.
That's such a good point. It's a reminder that we're not just along for the ride. We can actively shape our health with the choices we make every day.
Exactly. This deep dive really brought that home.
And we're back for the final part of our deep dive on reflux esophagitis. We've really covered it all from causes and symptoms to diagnosis and treatment.
And we've seen how you can really take charge of your digestive health. Making lifestyle changes, seeking help from your doctor, understanding potential complications. It's all about being proactive.
That's a really important point. As we wrap up this deep dive, we want to leave you with something to think about, something that might encourage you to keep exploring this topic even further.
Think of it as a little nudge to continue learning even after our conversation ends.
Exactly. So knowing everything we've discussed about reflux esophagitis, what can you do differently to manage your own digestive health?
What small changes could you make starting today that would have a positive impact?
Maybe it's paying more attention to which foods trigger your symptoms.
Or maybe it's finally making that appointment with your doctor to discuss those digestive issues you've been putting off.
Remember, information is only powerful if you use it.
And you now have the information to make good choices that will support your digestive health.
So what will your next step be? The choice is yours.
We hope this deep dive has given you the knowledge and confidence to take control of your digestive health.
Thanks for joining us on this journey. We'll be back soon with another deep dive into a new fascinating topic. Until then, stay curious and keep learning.